Hello everyone, and welcome back to another episode of Meet the Penis. I'm Dr. Alfie, and this is MTP 90. And today we're diving into a very important topic, penile implants. Specifically, we're going to break down some basic terms and concepts for patients undergoing implant surgery here at Perito Urology, where we use the Perito minimally invasive intrapubic technique. We're going to call this segment Penile Implant 101. So first, let's talk about the intrapubic technique. Unlike the traditional peno-scrotal approach, which requires incisions in the scrotum, the intrapubic technique only uses one incision about 2 centimeters above the penis. This method has several benefits, including reduced recovery time, less scarring, and a quicker time to the bedroom, which is what we all want, right, at the end of the day. Now onto the implants themselves. There are two main types of implants. There's the 3-piece inflatable implant and the 2-piece semi-rigid malleable. Now the semi-rigid malleable is straightforward. It doesn't require any additional counseling or training, goes up and down. Once you're given the go-ahead by your urologist, you can resume sexual activity without any maintenance. Now the 3-piece inflatable implant, on the other hand, consists of cylinders in the penis, a pump in the scrotum, and a fluid reservoir filled with salt water. Now the inflatable penile implant gives patients a penis that is rigid enough for intercourse and penetration, also known as a penetrating penis. And here at Perito Urology, we use the Coloplast Titan in 95% of our cases due to its reliability and effectiveness. Immediately after surgery, patients will go home with a JP drain, also known as a Jackson Pratt, which is essential for releasing excess blood and irrigation fluid for the first 72 hours. Now, proper use of this drain is crucial for optimal outcomes. Improper use can delay healing by 1 to 2 weeks. Next, we teach patients to pull down on their pump at least 3 times a day, giving it 10 pulls each time, obviously without hurting yourself. This maneuver prevents the pump from riding up during the healing phase. And once the staples are removed on post-op day 14, you won't need to do this anymore. Once you've been given the green light, we'll teach you how to cycle the implant. This means inflating the implant to its maximum capacity, then deflating it. Each inflate and subsequent deflate counts as one cycle. So cycling the implant twice daily means inflating and deflating it on 2 separate occasions. Cycling will be a crucial component of your rehab during the first 3 months. We also have a technique called the exercise, which helps maximize the length of the implant and penis. The exercise is a complement to the polyurethane cylinders that want to grow and expand symmetrically when maximum pressure is applied. This simple maneuver, once taught, can significantly enhance results and help return some penile length loss due to erectile dysfunction. Now remember, once you're cleared for sex, cycling the implant is the only maintenance required. Cycling the implant a few times a week will help maintain the flow of the salt water in your device and prevent episodes where the pump may feel too hard due to the pressure coming from the reservoir above. And remember, the best exercise for your implant is going out there and using it. Now that's a wrap for Penile Implant 101. We hope this segment has given you a clear understanding of the basics. If you have any questions or want to learn more, don't hesitate to reach out to us or visit our website. Thanks for tuning in to Meet the Penis, and don't forget to like, subscribe, and hit the bell icon so you never miss an episode. See you next time.